I'm your neighborhood news reporter, Adam Beam. Amid an already active flu season, an outbreak of measles is growing in West Texas. The question we had for health experts here, what's the risk the disease could find its way to the coastal bend?
On January 23rd, the first reported cases of measles in Gaines County were reported. What started out as only 2 has now jumped to 49 as of Monday.
This is probably the most contagious disease in the world.
While Gaines County in West Texas may be over 500 miles away, the risk of infection outside county lines is more than just a hypothetical, with cases now reported in neighboring Lynn, Yoakum, and Terry County. But what about here in the coastal bend?
One person has it, 9 other people get it, they spread it.
Dr. James Mobley is the health authority for San Patricio County and says the chances of measles making its way here is all too likely.
So I think it's probably will move across the state. Health officials, certainly at the Department of Health, State Health Services, are going to move very rapidly on immunization programs.
In Gaines County, the disease has mainly been amongst unvaccinated school-aged children. According to a report by the State Health Department, no schools in Nueces, Aransas, or San Patricio County exceed 10% when it comes to immunization exemptions. But for Dr. Mary Dale Peterson with Driscoll Children's Hospital, even a small percentage poses a big risk.
That these diseases that used to kill literally millions of children around the world have mostly been eradicated until people have just forgotten how bad it can be.
Both medical professionals making it clear the best method at combating a potential outbreak.
We have prevention that works, and just encourage everybody to be up to date on their vaccines.
You need 90% or more people to have that inoculation to really provide what we call the herd immunity.
According to the State Health Department, if you are infected or suspect that you have potentially been exposed, you should isolate yourself and contact your healthcare provider. However, the Health Department also adds that the best way to combat the disease is to be vaccinated against it. Reporting from Driscoll Children's Hospital, I'm your neighborhood news reporter, Adam Beam, Chris 6 News.
Adam, thanks for that report. Now, measles is caused by a virus and is highly contagious, and it can be fatal for small children. It kills more than 200,000 people a year, and the majority of those deaths involve children. Measles causes a red, blotchy rash that usually appears first on the face and behind the ears. The signs and symptoms of the disease appear around 10 to 14 days after exposure to the virus. Other symptoms include fever, dry cough, runny nose, and a sore throat.